Chronic and hidden infections are a huge source of inflammation for a lot of people. Today I'm going to share with you a little bit more about this, how to know if you have it and what to do about it. We have been focusing on inflammation a lot lately with our videos because underlying chronic inflammation is such a huge driver of chronic disease. It's one of the biggest things that we help people figure out in our practice. We've talked about stain, stress, toxins, allergens, infections, and nutrition. We're going through each one individually to help you know more. And today I'm focusing on the infection piece. Hi, I'm Dr. Anderson from Thrive in Functional Medicine. I want to share with you 5 things about infections specifically that are going to help you turn around inflammation. The first thing is, why is there inflammation with an infection? Because the immune system is built to help defend and repair. It's helping you defend from any threat or invader, including any type of infection. Now, the second thing I want you to know is, what are the types of infections that we can get? Well, any kind of an organism, including a bacteria, a parasite, a virus, even a fungus or a mold, can create a chronic infection and then thus trigger your immune system to create that inflammation, which is part of the response of trying to help you defend or repair or heal from this infection. So that inflammation actually is a good thing. It's a normal thing, but we want to address the underlying source. We don't want to just leave it lingering. So there are all types of organisms that can cause infection, but one of the biggest is the viruses. There are probably, we think, somewhere at least around 200 or more different viruses. We continue to identify more. And the thing about viruses is that we can't kill them with an antibiotic, and they continue to change or modify themselves. We might call it a mutation, which makes it very, very hard to keep up with them and sometimes even to treat them. So understanding what kind of an infection you have is really important when it comes to treating them. If you have a simple, let's say a bacterial UTI or a strep throat, that is something you can treat pretty easily with an antibiotic. But if you have a chronic viral infection or an acute viral infection, such as any type of cold, any type of flu, and many, many other illnesses as well, antibiotics are not going to help. In fact, they're going to make things worse, because all they do is kill off good and healthy bacteria in your gut, leaving your immune system even more impaired or crippled than it was before. So knowing what you've got is super important to knowing what to do about it. I would say by far the most common kind of infections that we see here are viral infections. Yes, I do test for these, and there are ways to look, but the approach is going to be the same whether we can identify a specific virus or bacteria or not. And so the third thing I want to help you today with is how to prevent infections. Obviously, preventing one is way better than treating one. An ounce of prevention worth a pound of cure. I'm sure you've heard that one before. There are good ways to prevent getting infections, and we're going to get to how to keep yourself healthy, but first of all, just how to limit exposure. So one thing that I see happening a lot is people coughing or sneezing on their hands. Don't do that. Definitely don't do that, because our hands touch everything. They touch our face, our eyes, our mouth. They touch surfaces. They touch our phones. They touch everything, and that's how infections are spread. So really, really, really avoid using your hands to cover coughs and sneezes. Yes, cover them. Cover them with your elbow, like this. And that way, you're not touching things with your elbows. Even better, cough or sneeze right down at the floor. That way, nothing's going up through the air or into anyone else. So prevent exposure by what you do if you have a cough or sneeze. A lot of viruses are transmitted through those respiratory droplets. The other way that you can help prevent exposure is, if you're sick, stay home. If other people are sick, stay away. However, there's a downside to that. I'll get to that in just a minute. So avoiding touching your eyes, your nose, your mouth is a good way to help prevent infection as well. So there's ways that you can reduce your exposure. And then the fourth tip that I have for you today is how to improve your terrain. Your terrain, you say, what does that mean? Well, that means your immune system, because there's this theory, the germ versus the terrain theory. What makes us sick? Is it just being exposed to bad bacteria or viruses, or is it the terrain, our immune system? And I believe more and more that's the key factor, because no matter how much we try to avoid exposure, we're going to get exposed to something sooner or later. The healthier we are, the healthier our terrain is, the healthier our immune system is, the less likely you're going to get sick, even if you are exposed. I've worked hundreds of hours and seen thousands of patients in the walk-in clinic that are sick, and rarely did I get sick because I focus on improving my own immune system. Now, there's a lot you can do to improve your terrain, but I'm going to just tell you my top 2 tips. Number 1, get enough sleep. Sleep is a huge thing that impairs or reduces your immunity. And the second thing is focus on your nutrition. When you eat sugar, it suppresses your immune system immediately for several hours. That's any sugar. And when you eat things like fruits and vegetables that are high in antioxidants and vitamins and minerals, you improve your immune system. So thinking about what you're eating and asking, is this going to improve my immune system or harm it? That's a great way to improve your ability to resist infection. Okay, next I want to cover what can you do to recover if you do get sick, because sooner or later we're all going to get sick. No matter how healthy you are, it's average for most healthy adults to get sick 1 or 2 times a year, and kids get sick more than that because they're actually building your immunity. So the first thing is, if you do get sick, it's not the end of the world. It actually helps improve and train your immune system and improves your immunity. So you don't want to avoid all exposure completely. When we isolate and then we're exposed, we're going to get even more sick more often because we have no immunity built up. So if you do get sick, don't panic. It's not the end of the world. But how can you recover faster? Same things as you do to prevent. Sleep more, improve your nutrition, get lots of rest. There are also lots of supplements and things that you can do to help your body fight infections. We're not going to get into that here because it really gets pretty personal, but there are definitely things you can do. I'll just mention a couple. Vitamin D is a really big one. Zinc is another one that can help you when you are dealing with something an acute illness, and vitamin C. Those are 3 of my favorites to do if you are sick. So those are ways that you can recover faster if you are sick, ways you can prevent getting sick in the first place, and a little bit of an understanding about what types of infections are out there and why do we get so much inflammation with an infection. So if you're needing more support, we're here to support you. Jackie had mentioned recently about our Thrive in FM University, and we do have a detox challenge, but I also have a viral course there. So if you know or think you might have some kind of chronic virus going on, that's a great resource to check out through our webpage or in the link below if you want. And if you have more questions, please leave a comment below. If you are needing more information or support in this area, let us know. And then we're going to deal with our last of the 5 major categories causing inflammation next, nutrition, and I'm going to give you a sneak peek coming up. I'm going to be doing in a few weeks a video about hair loss, one of the most common questions and concerns we get here at Thrive. And so I can't wait to teach you more about that as well. We will see you soon. Bye.